Welcome to Amazing Grays. This show is dedicated to the idea that active, informed older adults are an essential part of today's society. We provide information regarding senior issues and concerns and salute individuals or groups who demonstrate that productivity doesn't end at retirement.
Hello, and welcome to another segment of Amazing Grays. I am so pleased and honored to have with us Dr. Stephanie Coursen and her husband, Dr. Curtis Bannister. They are chiropractors with the Neck and Back Center. Today we want to talk about whiplashes, right?
Right.
And how do you get a whiplash, and how do you treat a whiplash, and all of those good little things that go into taking care of your neck.
You want me to start?
I want you to start.
Okay. Well, whiplash is actually an injury to muscles, ligaments, and tendons. It's when they're stretched beyond their normal capacity. They have a range that they're supposed to stay in. And when we're in some kind of an accident, they're stretched beyond that. And as a result, soft tissue swelling occurs, and then that's when a patient begins to feel pain. Most people think of whiplash as just like a car accident, and that is a very common injury during an accident. But you can get a whiplash from falling down a set of stairs or just falling in your living room because the muscles and ligaments are also stretched beyond their normal capacity at that point. And little micro tears occur in there, and that's where the pain comes from.
So you actually feel pain in the neck region solely?
Yeah, you feel pain in the neck region most often, but the neck muscles also span down into the lower back and the hips. And so injuries can occur in any area. I'd say in a car accident, the most common area is the neck, but I am treating patients currently right now for auto-related injuries that occurred in the lower back. Home injuries more often they're throughout the entire spine, from slips and falls on the ice and on their stairs. But the weight of the head is it's 10 to 13 pounds. A lot of people don't know that. It's like a bowling ball. It sets upon a very slender neck. So it gets pushed forward and backward at a high velocity, and then those micro tears occur, and then soft tissue swelling sets in.
Now, do you usually have pain right after an accident occurs?
A lot of times people don't, actually. Like in an auto accident, when a patient gets out of their car to assess to see if there was any damage to their car, they see a little bump and they're like, oh, thank God, I don't have any pain. But as the day progresses after any kind of an accident, swelling starts to increase and increase and increase. And when that swelling increases to the point where it's putting pressure on nerves and other structures in the body, you begin to feel pain. So a lot of times after people fall or in an accident, they don't even feel pain 1 to 3 days later. And then that's usually when we get a call to help them with their pain.
And what do you do to help the pain?
Well, when a patient first comes in, we do a thorough exam, including orthopedic testing, neurologic evaluations, range of motion testing, just so we can see exactly what's going on in their body. These indicate different things to us as chiropractors. And then we take x-rays. The x-rays help us to see if there are any fractures from their injury, but more importantly, as a chiropractor, we're looking for bones out of alignment, which is called a subluxation. We want to correct those misalignments so that the pain calms down. When bones are out of alignment, they put pressure on nerves. And so what we do is, as a chiropractor, we will adjust those. We also do modalities too. I want to mention that.
And modalities are what?
Modalities are therapies that we do to a patient, like therapeutic ultrasound. That helps to calm the muscle down faster so that the patient can return to their normal daily activities. Interferential therapy, it's a form of electrical stim. Some patients have TENS units at home. Interferential is like a stronger, more doctor setting TENS unit that we use so that the muscle heals at a faster rate. We have a therapeutic massage therapist who's licensed at our practice, and she will also give massages to help to get the toxins that occur from soft tissue swelling out of the body faster to return the patient to their normal daily activities and get them out of pain. But as chiropractors, our main goal is to get the soft tissue swelling down fast, get the bones put back in place so that there's less pressure on the nerves.
What's another name for whiplash?
It's actually hyperextension flexion injury. So that's the actual process. So you get extension first and then flexion. So it's called hyperextension flexion because it's beyond the normal range of motion.
No wonder it's called whiplash.
Yeah, it's a little easier. You're right. It's easier to say.
Okay, Dr. Bannister, I want to talk a little bit about spinal degeneration. You know, the long-term effects. How do you get
long-term effects?
How do you get it in the first place?
Well, certainly every injury, every traumatic event in your entire life has a cumulative effect. And let's say at age 60, 70, 80, whatever the state your spine is actually just an accumulation of everything that's occurred in your whole life. Areas that were traumatized when you were 20, 30 years old, those are the areas that you're going to tend to have more osteoarthritis in your spine. For example, let's say you did incur a whiplash in your 20s, you're going to have probably a little arthritis low in the neck. Usually the 5th, 6th, 7th bone down in the neck, you'll have a little bit of osteoarthritis right there, for example. Now, as a chiropractor, we want to obviously minimize the long-term effects of a traumatic event. We want to not only align, but we want to mobilize. And Dr. Stephanie was talking about the importance of stretching and massage. Well, we want to keep the vertebra and the spine moving after an accident. We don't want to put the cervical collar on. That is a thing of the past. We don't do that anymore. They know at the ER not to do that anymore. We want to keep the vertebra moving and the muscles flexing so they don't achieve a grade of scar tissue, which again later in life can contribute to osteoarthritis.
Now, in the seniors, they sort of have different problems with their back, with their neck, and so what you're basically saying is degeneration can happen through no accident at all. Is that correct?
Well,
am I correct about that?
I think certainly everyone's spine is traumatized to some extent at some point in their life. It could even be as a little tiny toddler. And again, a patient will come in sometimes and I'll ask them if they've had any injuries. They say, oh, no. And then upon a little further querying, I'll find out that they had an accident like maybe 20 years ago. And then I think, aha, that's why their spine looks like it does, because of the long-term cumulative effects.
I noticed that you brought some pillows.
Well,
well, these pillows, what's the purpose of these pillows?
This is a special pillow I'm holding right here. This is a cervical pillow. After, for example, an auto accident, this is particularly useful. There's a normal curve to the neck that must be attained. And after an accident, you'll lose that curve. And what happens, here's a bone, they go together like this, okay? And there's a nerve in there. And after an accident, they tend to squeeze that nerve a little bit. You want to open that a little bit. The chiropractic adjustment does that. This pillow, if you use it correctly, has a little bump, I don't know if you can see that, little bump on it. And that helps encourage that curve, and it helps open up that little hole in the bone. Again, here's a bone, they go together like this. You want to keep those open because there's a soft nerve inside. You don't want any pressure on that nerve.
So what you're actually doing is manipulating so that the hole gets bigger?
Exactly. Instead of just a fixed hole in a bone, again, two halves make a hole, and these are movable. They're meant to move. And a nice, gentle chiropractic adjustment opens that up. And the pillow helps keep that open. So this is used nightly, and actually patients become so attached to them, they end up just loving them and using them regularly, which is a good thing.
So I noticed that it's concave too, so that kind of your neck just fits right into the...
Ideally on your back, you would lie supine, and again, the little bump goes right in the little fossa in your neck.
And what happens if you sleep on your side?
Well, obviously you lose some of the beneficial effect of the pillow, but on your side is the second best choice. On your stomach is the absolute worst. I should mention that stomach sleepers always have neck problems, it seems like.
Did you have another one? I thought you had two. You just had the one?
I did have a lumbar support pillow. Want to hand that to
Okay.
me? Thank you. This is a pillow that normally would go in your car. Now, a lot of the newer cars have the lumbar support for the lumbar curve. This is ideal if you don't have one of those type of orthopedic seats. This would go in behind your back, encourages that curve in the low back. And what you want to do ideally is put it in, keep it there for a little while, and then take it out. Put it back in, take it out. Keep changing the curve to your spine. Because if you leave it there for a long time or don't use it at all, what happens, the disc in your low back tends to ooze and swell. So you want to keep changing this curve here. And this helps achieve that.
Okay, we've kind of covered the spinal degeneration and we've kind of covered the whiplash. As far as accidents, we also learned that there's different ways of getting a whiplash. It doesn't have to be an auto accident. It can be anywhere in your home, just to fall or to slip on something. Is there anything else that you'd like to add before we leave?
I'd like to mention the importance of exercise. You not only want to keep your vertebra straight, and most people understand the chiropractic concept of keeping your vertebra straight, but you also, again, you want to flex them, and exercise is so important. Just to get out and do a little walking, some kind of exercise to keep those vertebrae moving, and you'll live a long, healthy life.
And exercise also helps to build bone. So for people who suffer from osteoporosis, it's actually a bone formation technique. When you're out walking, it increases the pressure in the spine, which actually builds bone. So it's important for osteoarthritis and osteoporosis too. So I recommend for all of my patients 30 years and older that they're getting some kind of weight-bearing exercise, walking, running, something 3 times a week for 30 to 40 minutes.
Wow, that's interesting. Well, I want to thank you so much for coming with us to talk about whiplash.
Thank you.
And the scientific name again is?
Hyperextension flexion.
Thank you, and it's been nice.
Thank you very much.
Thank you for having us.
Take care.
Thank you for watching Amazing Grace. We are an all-volunteer organisation and are always looking for people to help us produce interesting programmes.